Hey everyone, how's it going? It's been more than a year since my last video. My oral minoxidil video got a lot of popularity, which I honestly didn't really expect. And as you can see, I kind of got new scenery behind me because I've finally moved. And I know it's still kind of messy, but at least I don't have a messy bed behind me. Well, I kind of do that way. But yeah, I thought, honestly, I didn't really have much motivation to make another video solely because I've gotten quite a lot of insults from my oral minoxidil video and a few other videos that I made, just saying that I was lying or bullshitting my information and stop being a pussy basically, and I just didn't have any motivation. But I thought there was some people that would want a follow-up video and some answers to your questions, because I've kind of neglected a lot of these questions because I thought I'd answer them in a video. So I'll read out a few questions that I've got in terms of oral minoxidil, because that's probably a lot of what a lot of people want to start taking. I of course stopped taking oral minoxidil just because of my side effects, about like heart palpitations happening, and now it's completely gone, by the way. And at the moment I'm taking topical minoxidil instead. I have had side effects with topical minoxidil, but it was not nearly as severe as oral minoxidil, even though I've only taken a very small milligram or percentage of the tablets that I was taking. So I'll go through if there is any decent comments. So one of the people said, I'll go to the most newest comments. So one person said it's probably a condition called nocebo. Honestly, I 100% do not think it's nocebo, because I was tracking my heart the whole time, so it's not all in my head. So I think that's a quick and easy question. I actually had a heart monitor on me, and it captured pretty much all the data that the doctors needed to say, look, stop oral minoxidil as well. So that was one of the things that I did have in my head, that would maybe be a nocebo effect, but it was 100% in confidence not a nocebo effect. I've been taking oral minoxidil for 2 days. Day 1, my resting heart rate increased from 55 beats per minute to 75 beats per minute. Day 2, my heart rate went up to 90 beats per minute. Scary, not too sure what to do. Is my body adjusting to the oral minoxidil? To me, that's a worrying increase. Well, the thing is, generally for an adult, your heart rate can go like 55 to 75 is not, it sounds like a huge increase, but there's some people that naturally has a heart rate that's around like 80 beats per minute, even though it says it's pretty high. But 90, I think it's pushing it. I think maybe just lower your dosage and see how you do, because a lot of this is trial and error. But when you're messing with your heart, you don't want to boycott it, or you don't want to really experiment with too high a percentage. Topical minoxidil gives you itchy scalp and dry hair. You think oral makes a difference? I didn't have any itching with oral minoxidil. I had a little bit of itching with topical minoxidil, but I think it's mainly due to my scalp being rather sensitive. So I think just see how you go. If you don't react too good to oral minoxidil, then topical minoxidil is kind of one of your only choices that you have. There's of course other experimental topical stuff that you can use, but minoxidil is kind of an off-the-shelf thing. So especially with topical, it's easy to get. 1.25 minoxidil, I've used it for about 25 days. experiencing dizziness, nausea, frequent urination, increased heart rate. Does it go away? I've answered that and I said yes, it does go away. But if you stop it, if you keep going at it, and you already have those effects, you would still have to worry, or you still have to lower your dosage even further then until your body kind of gets used to it, and then you can go up further. But then 1.25 milligrams seems fairly low, but everyone's body kind of reacts differently, so you never really know how you're going to react to a foreign chemical going into your body. Dizziness, nausea is what I had. It's a common side effect because in the end of the day, Minoxidil is like a blood pressure medication which lowers your blood pressure. So that was one of the effects that I had taking topical Minoxidil, but I was using quite a lot on my head, and I was using it when my hair was wet. So it was absorbing into my scalp at an accelerated rate, and that's why I had those side effects, and it hit me pretty hard. Did it increase your heart rate? Not a whole lot. I'd say like 5 to 10 beats per minute, but it didn't go to like the 90s, but it's gone from like 70 to 80. My heart rate is getting pretty fast, honestly, like compared to a normal adult, but it's still within the normal kind of range. I started oral Minoxidil a week ago, still no side effects. I'm using Regine shampoo. What's the Japanese tonics you mentioned? I completely forgot, to be honest. I stopped using them because I couldn't get them anymore because of COVID happening, and just the import cost was way too expensive. So I was going to say I was going to talk about it in another video, but it's a really hard tonic to get, so I honestly wouldn't bother. If the shampoos work for you, go for the shampoos. And yeah, at the moment I'm only using Minoxidil, and I'm crushing up finasteride as well. I think I mentioned that in my last video. Where did I get Lonitin from? I had to get a doctor's prescription for it. Have you increased any body hairs when taking it? I did not. I had eyebrow hairs, actually. So this area is actually shaved, so it doesn't really do much justice, but it got really bushy. But yeah, I've been on 5 milligrams a day without side effects. Healthy vegan diet. I don't know. I can't say anything regarding that. No finasteride. What kind of doctor? There we go. I started taking 5 milligram. What does the heart palpitations feel like? Kind of feels like your heart keeps skipping a beat, and you have to like go, like, yeah. It's a weird feeling, but you're struggling to breathe one kind of breath, and you just kind of feel it around this area too. Did you lose the gains when stopping oral Minoxidil? I can't really say. My hair's obviously still here, but it wasn't as good when I was doing oral Minoxidil, for sure. It was a lot better when I was doing oral Minoxidil. Did your beard get any gains? I don't have a beard. Asian genes. And you got the scruff. Bum fluff, as people would say. It sounds like anxiety pains. Yeah, I'm not going to answer that. I think that's pretty much it. Make your bed. Alright, so hopefully that kind of answers a few of your questions. Oh, this got a lot of upvotes. Let me read this one. A few things. Psychomaster. Yeah, anxiety. As you read the side effects and knew what the pain were, you didn't get gains in 2 months. This would not be enough time. Whatever gains you would be lost. Discontinuation of Minoxidil. While Minoxidil is far more safe and effective than the expensive tonics you put up, your doctor isn't going to take time to explain all this to you, but you should fact check on them. You don't have hair loss, so I'm surprised they put you on oral Minoxidil. I don't know if this is worth answering. The webcam really doesn't do much justice, but there's a lot of thinning going on here. I did go to a few doctors, and yeah, it's just a general case of male pattern baldness. It's not like severe or anything. Like, I know I'm kind of Norwood 2 pushing Norwood 3, but it's not really that crazy. Like, I can still kind of disguise my hair loss. Obviously it's not a big deal to me, but I want to take action to prevent further hair loss like everyone else does. Everyone wants to have a good head of hair. But anyway, hopefully that helps, and if you have any questions, let me know. I have been taking a new shampoo, which I don't know if I'll make another video after this. Depends how many comments I get and things like that, and if people are interested in more videos like this, then I'll make it. But if I just get insults after insults, and I'm honestly not going to bother. Alright, see you later guys, have a good one, peace.